Dear members of the European College of Sports Science, dear colleagues, I'm delighted to present our study here at this virtual 25th anniversary Congress of the European College of Sports Science. And I'm so happy that we're here together, united, making this event happen in the name of sports science. The study I'm presenting today is based on my PhD dissertation, and it is entitled Artistic Gymnastics Improves Health-Related Biomarkers at Primary School Age. Unlike other sports, artistic gymnastics requires the performances of technical exercises on different apparatuses, where the gymnasts have to overcome their body weight and in many cases multiplied several times when they're dismounting or when they're tumbling. And therefore, optimal health and a level of physical fitness are both essential for the performances of the routines. And the aim of our study was to assess the health biomarkers in relation to physical fitness in children practicing gymnastics, whilst estimating the benefits of regular gymnastics training at this age. This study included 90 children from the United Kingdom. 49 of them were artistic gymnasts. They were practicing gymnastics for at least a period of 2 years, and they were practicing on average 4 hours per week. They represented 5 different gymnastics clubs within 3 different areas in the United Kingdom. The other 41 children formed our control group, and they were not seriously engaged in any sports apart from their physical education lessons at school. In order to assess the health biomarkers in relation to physical fitness, we applied the AlphaFit Physical Fitness Test Battery, which is widely recommended in the literature for the assessment of children and adolescents. And on the next slide, you can see the main components, which are main concerns under the AlphaFit Physical Fitness Test Battery. All of the measurements were taken in accordance with the guidelines of the AlphaFit Test Battery. In order to assess the motor fitness, we applied the 4x10 meter shuttle-run test. The hand grip strength test and the standing long jump test were applied to assess the musculoskeletal fitness. And in order to assess the cardiorespiratory fitness, we applied the 20 meter shuttle-run test. And for the administration of this test, we created a specialized software. This software was specially created as part of my PhD dissertation, and it is called Beep Shuttle Junior. I presented this software in 2017 at the European FIEP Congress in Luxembourg. The software uses the original 1-minute Ledger's protocol, and it provides information on all of these parameters that you can see on the right side of the slide, in addition to the estimated maximal oxygen uptake for each participant tested, as well as a percentile score of the VO2 max, which is based on gender-specific and age-specific international norms for children and adolescents. This software was published in a peer-reviewed journal in 2018, and it can be accessed on the website provided at the bottom of this slide. In addition to that, we also calculated the parameters shown on the next slide. We calculated the percentile scores for each parameter. For the height, the weight, and the body mass index, we used WHO Andro+, which is software provided by the World Health Organization. For the other parameters, we used the published international norms for European children. The statistical analysis were conducted with SPSS statistics software. We used test of normality to check the distribution of the data and descriptive statistics. We compared the boys from the control group with the male gymnasts, and we also compared the girls from the control group with the female gymnasts. Depending on the distribution of the data, we compared their means by using the independent t-test or a Mann-Whitney U-test. And the anthropometric parameters of the children are presented in the tables on the next slide. On the left, you can see the girls in red, and on the right, you can see the boys in blue. The main anthropometric parameters, including height, weight, body mass index, and percentage body fat, were significantly lower for the gymnasts in comparison with the control groups. An interesting observation here was that the upper arm muscle area did not differ between the groups. However, the relative upper arm muscle area was significantly higher in favor of the gymnasts in comparison with the control groups. That was the case in boys and in girls. And that showed that the children who were practicing gymnastics had larger muscle mass per unit body weight. And then on the next slide, you can see the distribution of the percentile score of the body mass index. It is very well clear that the gymnasts in the background were within the norms, while the control group, half of it, was assessed as obese or overweight. Now, it is good to mention here that in line with our previous research, here as well, the body mass index didn't provide accurate assessment for some individual children with larger muscle mass. That was the case for these two gymnasts who were assessed as overweight in accordance with the body mass index. However, they were not overweight. They had lower percentage of body fat, and they had high value of their upper arm muscle area, one of the highest in their groups. And that can be very clearly seen on the next slide, where you can see the distribution of the percentile score of the percentage body fat. All of the gymnasts, 49 out of 49, were within the norms, and 17% of the control group were assessed as obese and 39 as overweight. On the next slide, you can see the other parameters from the health biomarkers in relation to physical fitness. On the left again, you can see the girls in red, and then on the right, the boys in blue. There was no statistically significant differences between the absolute values of the hand grip strength test. However, the relative hand grip strength was significantly better in favor of the gymnasts, both in boys and in girls, in comparison with the control groups. And that confirmed that the children who were practicing gymnastics had better strength parameters in relation to their body weight. All of the other tests were also significantly better in favor of the gymnasts, both the absolute value of each test as well as the percentile score. So the gymnasts had a better lower body strength, better motor fitness, and better cardiorespiratory fitness. And also the gymnasts had a very high percentile score, an average of 90 for most of the tests. In conclusion, artistic gymnastics in childhood contributes to maintaining a normal body weight and has a positive impact on the health-related biomarkers of physical fitness. Parameters such as percentage body fat, relative upper arm muscle area, relative hand grip strength are essential and should be used as part of the anthropometric assessment for autistic gymnasts. And with this slide, I would like to conclude my presentation, but also I'm completing a big stage of my career by presenting the last part of my PhD study here in front of the international scientific community. I would like to mention it was a great pleasure to work on this study for 3 years. I would like to say thank you to my supervisors for all of their help and support. Thank you to Dr. Lubomir Petrov, and thank you to Dr. Albena Alexandrova from the Department of Physiology and Biochemistry from the National Sports Academy in Bulgaria. And thank you so much to our co-author, Professor Monem Jani from the University of Cambridge, for his input in this study. And it has been great that we are here at this virtual 25th anniversary Congress of the European College of Sports Science. We are here, we are together, we are united, we are sports science. Thank you.